We are going to discuss the topic antidiabetic drugs for B from third year students, medicinal chemistry second. The contents are introduction to antidiabetic drug, insulin and its preparation, sulfonylurea that is tolbutamide, chlorpromazine, glipizide, glimetrol, biguanide, metformin, thiazolidinedione, pioglitazone, rosiglitazone, meglumide, repolyvinil, metagonine, glucosidase inhibitor, ecrabose, and voglibose. Here we are going to discuss antidiabetic drug. The name itself displays that antidiabetic agents are the medication and treatment used to manage and control diabetes, a chronic medical condition categorized by elevated blood sugar level. There are several classes of antidiabetic agents, each with its own mechanism of action, specific identification, and the most common classes of antidiabetic agents are insulin and its preparation, and oral antidiabetic drug, that is sulfonylurea biguanides, thiazolidinediones, meglitide, alpha-glucosidase inhibitor, and in sulfonylurea, tolbutamide, chlorpromamide, glipizide, glimepiride, and biguanides, it's metformin, thiazolidinediones, pioglitazone, rosiglitazone, meglitinides, repaglutide, and metagonide, alpha-glucosidase inhibitor, ecarbose, and voglibose. In this first preparation, that is insulin and its preparation, here insulin is a crucial hormone that regulates blood sugar levels. It's primary treatment for diabetes, especially in cases where the body does not produce enough insulin, that is type 1 diabetes, but doesn't use it effectively, that is type 2 diabetes. Insulin therapy involves using various types of insulin preparations to manage blood sugar level in people with diabetes. These preparations can be categorized based on the onset, peak, duration, and action profile. First one is rapid acting insulin. This type starts working within 15 minutes after injection, peak within 30 to 90 minutes, and stays active for 3 to 5 hours. Example, insulin aspart and insulin lispro and insulin glucine. Second one is short-acting insulin. These insulins typically start working within 30 minutes, peak at 2 to 3 hours, and remain active for 3 to 6 hours. Regular insulin, also called soluble or neutral insulin, falls under this heading. The third one is intermediate acting insulin. This type usually begins working within 2 to 4 hours, peak around 4 to 12 hours, and can remain active for up to 18 hours. Example, NPH insulin, that is neutral protamine hydrone. Long-acting insulin, that is long-acting insulins have a slow onset of action, no pronounced peak, and provide a steady level of insulin for an extended period, typically up to 24 hours or longer. Example include insulin glargine, insulin determinate, and insulin degludec. Fifth one is ultra long acting insulin. This is a newer category that provides an even longer duration of action, often beyond 24 hours. Insulin degludec is an example of ultra long acting insulin. Insulin can be administered via injection using syringes, insulin pens, or insulin pumps. More recent innovations have also been introduced inhaled insulin for some patients, offering an alternative to injection. The oral antidiabetic agents are sulfonylurea. This class of medication work by stimulating the pancreas to release more insulin, and they are typically used in type 2 diabetes. Example, tolbutamide, chlorpropamide, glipizide, glimepiride, and the mechanism of action of sulfonylurea involves binding to specific receptors on the beta cell of pancreas. which are responsible for producing and releasing insulin. When sulfonylurea bind to these receptors, they cause a series of biochemical events within the beta cell, leading to the following effects. First one is increased insulin secretion. Sulfonylurea promotes the release of insulin from the beta cell of pancreas, and this results in higher level of circulating insulin in the bloodstream. Then second one is glucose uptake. The increased insulin level facilitate the uptake of glucose by cells, and particularly muscles and fat cells. And this action reduces the concentration of glucose in the bloodstream. In this slide, it is explained that mechanism of action of sulfonylurea and glenide in pancreatic beta cell, regulation of insulin released by plasma glucose. A rise in plasma glucose level associated with mean resulting in increased glucose uptake, followed by intracellular metabolism resulting in increase in intracellular ATP. A rise in intracellular ATP inhibits ATP-sensitive potassium channel, and potassium channel inhibition results in membrane depolarization with the resulting activation of depolarization activated calcium channel. A rise in intracellular calcium promotes fusion of vesicles containing insulin with the cell membrane and subsequent release of insulin. Then after the sulfonylurea and glenide binds to a site of sulfonylurea receptors and channel subunit, which inhibits these channel ATP binding to different nucleotide binding domains, that is NBD, on the cytoplasmic cell. Binding of either ATP or these drugs to their site of action produces conformational change that inhibits potassium permeability. Glenides bind with lower affinity than sulfonylurea and as a result have a much shorter duration of action. To be effective, glenide have to be given with each month, while sulfonylurea can be given once a day. Sulfonylurea have once a day dosing and glenide have a rapid onset and short duration of action. They have to be taken just prior to each meal. Tolbutamide, it is least potent short-acting sulfonylurea. It is safely used for the treatment of type 2 diabetes in elderly patients and those prone to hyperglycemia. It is a synthesis of tolbutamide where 2-methylbenzosulfonamide is reacted with ethyl chloriphenate and which gives ethyl tosycarbamate and fusion with butane 1-amine and release of ethanol molecule. It gives tolbutamide. Here are the structure of chlorpropamide and glyphosate, glimepiride of same category. Maglutinides, these class of drugs stimulates the pancreas to produce insulin, but in a faster and shorter acting ways compared to sulfonylurea. They bind to sulfonylurea receptor present in pancreatic beta cell. It leads to the closure of ATP-sensitive potassium channel and depolarize the beta cell membrane, and it opens voltage-gated calcium channel and stimulate beta cell to secrete more insulin and typically taken before meals. And here are the examples, that is repaglinide and nataglinide with a structure. Now the next category is biguanides. Biguanides, the metformin is most commonly used biguanide. It works by decreasing the amount of sugar produced by liver and improving the body's response to insulin. Mechanism of action of biguanides are they reduce hepatic gluconeogenesis, decrease intestinal absorption of glucose, increase glucose uptake, and utilization to decrease the blood sugar level. As they improve the insulin resistance, they are also known as insulin sensitizers. The example of metformin with its structure. Next category of drug is thiazolidinediones. These medications work by improving insulin sensitivity in the body's cell. They bind to this too and stimulate peroxisome proliferator activated receptor gamma, that is PPAR gamma, due to which they are also known as PPAR gamma agonists. They increase the expression of GLUT1 and GLUT4 receptor on the cell surface to increase glucose uptake. They reduce insulin resistance and hepatic gluconeogenesis. Examples include that is euglitazone and rosiglitazone. Here are the structure of the drugs with their IUPs.